Have you ever felt tired, even after resting all night? Or maybe you've noticed that you're always thirsty, always hungry, or that small cuts take forever to heal. If that sounds familiar, your body might be trying to tell you something important, something millions of people around the world are silently living with every single day: diabetes. But what exactly is diabetes? How does it affect your body? And most importantly, can you prevent or manage it naturally? Stay tuned, because in this video, we'll break down the science of diabetes in simple terms, what it really means, how it happens, and what you can do starting today to protect your health. Let's dive right in. Diabetes is not just about too much sugar. It's a chronic metabolic condition that changes how your body turns food into energy. Here's what happens inside your body. Every time you eat, your food is broken down into glucose, a simple sugar that gives your cells the energy they need to function. This glucose travels through your bloodstream, waiting for a special key, the hormone insulin, produced by the pancreas. Think of insulin as the key that unlocks the doors of your cells, allowing glucose to enter and be used for energy. But when someone has diabetes, this key doesn't work properly. Either the pancreas isn't making enough insulin, or the body's cells have become resistant to it, meaning they no longer respond effectively. As a result, sugar starts building up in the bloodstream instead of entering the cells. Over time, this excess sugar acts like a slow poison, damaging blood vessels, nerves, and vital organs. The most dangerous part is diabetes often develops silently. Many people live for years without realizing their blood sugar is out of balance until complications appear. That's why understanding how it works is the first step to protecting yourself. There are three main types of diabetes, each with its own causes and challenges. Type 1 diabetes is an autoimmune condition. Here, the immune system mistakenly attacks and destroys the insulin-producing cells in the pancreas. Without insulin, the body cannot regulate blood sugar levels at all. This type usually appears in children or young adults and requires daily insulin injections for survival. Type 2 diabetes, on the other hand, is the most common form, making up nearly 90% of all cases. In this type, the body still makes insulin, but it doesn't use it properly. This is called insulin resistance. Over time, the pancreas can't keep up with the increased demand for insulin, and blood sugar levels rise. The good news is, it can often be delayed, controlled, or even reversed through healthy lifestyle changes. The third type is gestational diabetes, which occurs during pregnancy. Hormonal changes make it harder for insulin to work, leading to higher blood sugar. Usually, it disappears after delivery. But women who experience it have a higher risk of developing type 2 diabetes later in life. Each type of diabetes is different, but they all share the same root problem: the body's inability to properly use insulin. And that imbalance affects far more than just blood sugar.
There are three main types of diabetes, each with its own causes and challenges. Type 1 diabetes is an autoimmune condition. Here, the immune system mistakenly attacks and destroys the insulin-producing cells in the pancreas. Without insulin, the body cannot regulate blood sugar levels at all. This type usually appears in children or young adults and requires daily insulin injections for survival. Type 2 diabetes, on the other hand, is the most common form, making up nearly 90% of all cases. In this type, the body still makes insulin, but it doesn't use it properly. This is called insulin resistance. Over time, the pancreas can't keep up with the increased demand for insulin, and blood sugar levels rise. Type 2 diabetes often develops due to a combination of genetics and lifestyle factors, including poor diet, lack of exercise, stress, and being overweight. The good news? It can often be delayed, controlled, or even reversed through healthy lifestyle changes.
The third type is gestational diabetes, which occurs during pregnancy. Hormonal changes make it harder for insulin to work, leading to higher blood sugar. Usually it disappears after delivery, but women who experience it have a higher risk of developing type 2 diabetes later in life.
Each type of diabetes is different, but they all share the same root problem: the body's inability to properly use insulin. And that imbalance affects far more than just blood sugar. When blood sugar stays high for too long, it silently harms your body from the inside out. High glucose acts like sticky syrup flowing through your veins. It damages the walls of your blood vessels, reducing blood flow and oxygen delivery. Over time, this leads to complications that can affect nearly every part of your body. Your heart and arteries are among the first to suffer. People with diabetes are 2 to 4 times more likely to develop heart disease and stroke. It also increases blood pressure and cholesterol, making the heart work harder than ever. Next, your kidneys, which act like filters for your blood, become overworked. The tiny blood vessels in the kidneys get damaged, leading to kidney disease, one of the leading causes of dialysis worldwide. Your eyes are also at risk. High blood sugar damages the delicate blood vessels in the retina, leading to blurred vision or even blindness, a condition called diabetic retinopathy. Your nerves can become damaged too, especially in your hands and feet. This causes tingling, numbness, and slow wound healing, which can sometimes lead to infections or, in severe cases, amputations. But beyond physical damage, diabetes can deeply affect your emotional health. Constant fatigue, worry, and medication can lead to anxiety and depression. The truth is, diabetes doesn't just affect one organ, it affects your entire system. That's why prevention, awareness, and consistent management are absolutely essential. Here's the best part: diabetes may be serious, but it's not unbeatable. With the right lifestyle, it's possible to control, manage, and even reverse early-stage type 2 diabetes naturally. Start with your diet. Cut back on refined carbs and sugary drinks. Choose whole foods like vegetables, fruits with low sugar, legumes, and healthy fats. Include fiber-rich foods which slow down sugar absorption. Next, exercise is your best natural medicine. Even a 30-minute brisk walk daily can improve your insulin sensitivity and help your muscles use glucose efficiently. Weight management also plays a major role. Losing even 5 to 10% of your body weight can dramatically reduce your blood sugar levels and risk of complications. Then comes stress management. Chronic stress triggers hormones that increase blood sugar, so prioritize sleep, meditation, and relaxation. And of course, stay hydrated and avoid smoking and alcohol, which can worsen diabetes-related issues. If you already have diabetes, regular monitoring is key. Keep track of your blood sugar levels, take medications as prescribed, and visit your doctor regularly. Remember, small, consistent changes are far more powerful than big, temporary ones. You don't have to overhaul your life overnight. Start with one healthy habit, stick with it, and build from there. Here's a fact that surprises many. Almost 1 in 2 people with diabetes don't know they have it. That's why awareness and regular checkups are life-saving. Routine blood sugar tests, especially after age 40, can detect diabetes in its early stages, before symptoms appear. Early diagnosis allows you to take action before complications set in. But awareness isn't just about testing. It's about understanding your risk factors. If you have a family history of diabetes, are overweight, lead a sedentary lifestyle, or have high blood pressure, your risk is higher. The good news: awareness leads to action. Once you know your risk, you can make small changes. Eat better, move more, and monitor your health regularly. Education is equally powerful. Talking about diabetes with your family, friends, and community helps break the stigma and encourages more people to get tested early. Remember, prevention isn't just about avoiding illness. It's about living a longer, fuller, more energetic life. So take charge of your health today, because when you understand diabetes, you don't just manage it, you control it. If you found this video helpful, make sure to like, share, and subscribe to our channel for more science-backed natural health tips. Together, let's make healthy living simple, one choice, one meal, and one step at a time.